The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
Why in the heck would you adjust an infant days old?
The best chance at having the baby is to get adjusted before you're thinking of getting pregnant. Then you get pregnant and gravity can do its job with symmetry in the pelvis to make sure the baby's in there correctly. If they're having trouble crawling, if their attitude isn't right, if you can tell they're just off, if they're not sleeping well, that's a lot of the reason the parents would come in more than just a regular treatment plan. Growing pains, when you get adjusted, it won't hurt as much because things are symmetrical. You need to normalize it. We need people to see that that's a thing that people do and that's a thing that keep people healthy.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. Dr. Kevin Wall here, your host. Hey, have you ever seen some of those TikTok videos out there where everybody's cracking their necks and cracking their backs, and these guys are yanking on big tubes, pulling people, and man, these some are chiropractors. I don't know what's going on, but now it's even got worse. Have you seen those crazy chiropractors adjusting infants? Holy mackerel! Why would you ever adjust an infant? These guys got to be nuts. This is probably the most controversial conversation, and I've had a few conversations on the podcast about adjusting infants, but it's probably the most controversial thing people seem to be wired up about. I get a lot of conversations, a lot of questions, a lot of looks when we talk about adjusting an infant. So today, we're going to unplug you from that misunderstanding for not only your health, but for how to raise healthy children beyond and around that time period. So before we get going, though, there's a video we're going to watch briefly on this exact concept. Let's take a look.
When should a kid get adjusted? As soon as they come out. As soon as you can get your hands on them, the best time to start it is now. So a baby is born, and they come out, and it's an intense day. Maybe they get some support coming out of the birth canal, and now they are subluxated. It doesn't get corrected within 5 to 7 days. Cellular degeneration starts to happen, and now they start living a life that is less than. So no matter what age, he found after 2 to 3 weeks of joint fixation, 18 months was required in order for optimal healing to be attained, but even then it was incomplete. So you want to get your hands on kids as fast as possible.
All right. Well, there you go, man. These guys are actually not only talking about adjusting infants, but they want to get their hands on your babies in the first 7 days of their life. Holy mackerel. So to really solve this problem, I just thought, well, I'm just going to invite one of the culprits into the show to help clear up this confusion. Would you guys welcome to the show Dr. Kim Thor-Adams. Dr. Kim, welcome to the show.
Hi, thank you for having me.
Hey, I know you're a second-generation chiropractic physician. You also are a national speaker, speaking all over the country. You've wrote, I think, 1 or 2 books, Growing Up Fearless. But I know you also have a focus probably on pediatric chiropractic, which is really the concept of what we're talking about, children, infants getting adjusted. Let's first start off with a little bit about you're in Norfolk, Nebraska. Is that where you're from? Tell us about yourself.
Yeah, it is. And I got all my numbers done early in school to go on a preceptorship and internship. And I went to Southern California thinking I'd never come back home. And here I am in my hometown.
Well, I love the Midwest. As you know, I'm an Iowa farm boy, so it never really gets out of you. So good to have you on the show. Tell us about your book real quick, what it's about, why you wrote it.
Yeah, the book is called Growing Up Fearless, and I wrote it in a time where mandates were all over, and I wanted a place to go raise my hand and ask questions, and not one existed. I grew up getting adjusted. We said no thank you to all of the medical things because we were healthy. We got adjusted all the time. So I found some other second, third, fourth generation chiropractors to help me write the book. And in the beginning is pretty much talking about how we need no help, just no interference, how we don't need to be scared of disease. Let's play in the dirt and breastfeed our children. And then the second half of the book is a story of how I was able to keep my kid in public school without a mask on. And some people around the country didn't even try. And I think we all need some bigger balls to stand up if we have to stand up again. So that's why I wrote it.
Well, if you're listening and you're raising kids, you need to buy the book. You need to read it because that concept you said, life needs no help. It just needs no interference. And I think that's something most people have lost track of, even the possibility that your children could be healthy without a bunch of pharmaceuticals, vaccinations. In fact, another one, I'm curious that you brought it up. A lot of people out there they're kind of waking up to this vaccine, all the dangers, this thing with Corona really illustrated what you and I have been talking about. Now people are waking up, but they want to maybe get their kids not vaccinated, but they can't get past the schools or the colleges. Do you have any thoughts on how to help people overcome those things?
Of course I do. This is the land of the free and the home of the brave, supposedly. And in the land of the free, our rights are being taken away every single day. And it drives me crazy. In Nebraska here, and I think Iowa's similar, we have a religious exemption and a medical exemption to say no thank you to medical procedures that we want to say no thank you to. And so that's what we do. You simply sign a paper on a website through the state of Nebraska. You don't need to any professional help of a medical doctor if you choose the religious exemption. You sign it as a parent, you get it notarized, you take it to the school, lickety split. That's how it works for public school in Nebraska. In other parts of the country, I know you have no exemption. Private schools are all different. Some Catholic schools around here make you vaccinate. They won't take the religious exemption. Maybe they'll take the medical one. Every private school is different. But if you don't know your rights, how can you stand up for them? So that's the first step, to know what your state allows.
Well, they're out there, and I just find out that you sometimes just have to ask. They'll pretend that there is no way around, and then you ask, and all of a sudden you find there is. And most states do have an option, so look into it. But let's just jump right into the most obvious elephant in the room. Why in the heck would you adjust an infant, days old? I'm going to start the conversation and maybe lead it, which is this concept of difficulty during birth. Let's start with the concept of breech babies, because you deal with breech situations, breech babies, maybe even before they're born. Is that true?
Yeah. So my favorite patient, I usually say, is a 4-hour-old baby, but really the best chance at having the baby is to get adjusted before you're thinking of getting pregnant. So you get adjusted, you become stable, the body is balanced, the pelvis is balanced, then you get pregnant, and gravity can do its job with symmetry in the pelvis to make sure the baby's in there correctly. Sometimes if I get a pregnant mom at week 38, it's much more difficult for the balance and symmetry of the ligaments with gravity in the pelvis for it to do its job. And I'm pretty good at it. I can't quite advertise it, but last year there was not one single breech baby that entered my office and left breech before they were born, which was pretty stinking cool. And I don't adjust the baby, I adjust the mother specifically and thoroughly with a chiropractic adjustment, using my hands to move their bones back where there should be so that the nerves can flow and things can be great. In the research, it talks about decreased labor times, decrease the amount of pain you have to have a baby. But step one, you want the baby to be head down. And so if the pelvis should be symmetrical for gravity to do its job, that's what happens when you do it right.
You definitely deal with breech situations. So moms out there dealing with that. But let's say, things are going as they are and now the baby's coming out. Well, the first thing that I'll tell people that they don't realize is that babies are supposed to come out face down. They have to get the shoulders through, they have to get the baby to rotate. So we have this term out there that they use, external cephalic version, which they actually take the head and help the baby rotate. And we don't think about this because often if it's done correctly, this doesn't occur. But in America, a lot of babies are twisted out of the canal by the doctor. That's one of the first problems I see why babies' necks get wrong. But why don't you take it from there? What are the issues that really cause babies to need to get their neck checked after birth?
Why would a baby need adjusted? Well, if you've ever seen them come out, it's quite obvious. Any small shift in their spine, any contortion of how they were in the belly, any quickness of them leaving the birth canal is all reason enough to go to the chiropractor. I've been a chiropractor for 15 years. There's only been one tiny baby, and I see a lot of babies. There's only been one tiny baby in my whole 15 years that didn't need anything at the chiropractor. So I always say I like to catch it before you can say things like ear infection or colic or constipation, before you can say any of that. The patients I know well let me come visit them. If they have the baby at home, great, I come visit. Sometimes I go visit my friend in the hospital. Sometimes they bring them to me on the way home from the hospital. But if you think of it preventatively with a wellness mindset, if you're allowing the body to balance for the brain to talk to the body better, it functions better and heals better. And that can mean anything you want it to mean if the body is capable of that.
So I always told my patients that birth trauma is just a reality in America. Babies are born on the doctor's schedule. Often they're induced. They're on a doctor's vacation schedules. They use hands, forceps, suction cup to pull these babies out, rotate their neck, rotate their body, and just a lot of things go wrong. It's so simple to catch it early on and fix it. But then I hear the concept, well, but my baby was C-section. A lot of people think that babies won't be injured in that process. Do you think it's important to check all babies or just the babies that are born normally?
We were created with such intelligent design that the mother's body was made to excrete the baby out. The squeeze of the cranial bones on the way out is necessary for optimal health if you can. I've seen breech babies delivered at home. I've seen breech babies caught by a mother in their own house if they come out too quickly. Babies can be born in a car, in a bus, in a train, sometimes on the way to the hospital. A lot of it is mindset, and fear makes stress hormones not ideal, and those hormones can change labor. And I always say more interventions lead to more interventions. And so checking every single baby, no matter how they are born, is essential.
So really what I think you're saying is you don't like C-sections at all. You almost don't think they're necessary.
You never know if they're necessary until
true?
you know the outcome of the baby. And someone's level of fear of, will my baby be okay? Can I do this? Will it be okay? Is often swayed by what they read and what they hear and what they see.
Babies are born. A lot of people never get their babies checked. In my understanding, it was about maybe 2% of babies ever get checked for subluxations in their neck, which is shifting of the vertebrae, twisting of the spine, problems created from the birth trauma. I don't know if your statistics are any less, but how do women know if they should get their baby checked? What are the symptoms? What are the signs? What are the conditions?
I only assess the spine for subluxation. I don't treat a thing. I allow a subluxation to leave the body so that the body can heal. If you have a subluxation, the body is not at ease. It is not 100%. It is at dis-ease. The things that present, mothers bring babies that come into my office with colic, constipation, acid reflux, torticollis. Maybe they prefer one breast over the other. Maybe they're crabby. Maybe they don't sleep good. Maybe they don't poop good. Maybe the mother doesn't know quite what's wrong with them. But maybe the baby's simply saying, take me to a chiropractor, because often when a mother leaves, they report better sleep, calmer babies, happier babies. So like even your 2-year-old throwing a tantrum at the restaurant, you can't say that, unless you've taken them to a chiropractor recently, you can't say that that's the calmest that kid can be, because maybe their nervous system just isn't.
Well, that definitely takes us into the next stage. So after the infant stage, people could get over that. Maybe they get their babies checked or not. Then they think, the kids are great. Kids don't have back problems. They have to be in, wait till they're older before they get there. These are myths or thoughts people have. You adjust toddlers, young children. What do you see there? I know subluxation is the cause of most of those things, and you're not fixing their colic. Their body will fix it. But how do mothers know, how do families know when to get their kids checked as they grow?
To ingrain in your brain the fact that your brain can't talk to your body as good as it could unless you were taking your baby to the chiropractor. That's when their brain can fully communicate with your body. That's reason enough to take them. However, 2-year-olds, if you've ever seen one, they're tornadoes. They fall, they bump into things, they think they're Superman. So a lot of times teething is earlier than that makes you need a chiropractor. If they're having trouble crawling, if their attitude isn't right, if you can tell they're just off, if they're not sleeping well, that's a lot of the reason the parents would come in more than just a regular treatment plan.
A lot of people are so focused on pain or symptoms, and because children don't know what normal is and don't communicate at any age, very well, I think we have to look for more functional things, and you just labeled those things that, would determine if their body's working, like sleep, like attitude, like eating, like digestion, like weight, all attention deficit. Do you deal with ADD, ADHD?
I don't see it in my adjusted patients where the grandmother's been in and the mother's been in and now the baby's there. And even in my own kids, growing pains, mine are 14, 10, and almost 4. So like growing pains, when you get adjusted, it won't hurt as much because things are symmetrical. But a lot of times people even just chalk it up to growing pains.
You're pretty passionate about this, Doc. I love it. I'm sure you raise some eyes around these conferences when you chat. What makes you so confident that, man, I'm in agreement, but I'm just curious what makes you so confident to be able to speak to our audience with that type of certainty?
I think my confidence, one, comes from I grew up being the daughter of a chiropractor, and so I see it, and the proof is in the pudding, and like chiropractic miracles exist. Also, in chiropractic school, I had twins and they only lived a half an hour, and I held them until their heartbeat stopped. And it changed my life completely and my perspective on life. And it took me a while, but I realized that I was put on this earth for a purpose and I'm going to change the world. And this is how I know to do it. BJ Palmer says, you never know how far reaching something you may think, say, or do will affect the lives of millions tomorrow. So not only do I see patients, I write books, I speak at things, I'm a coach of other chiropractors, and I say yes without hesitation to podcasts because you never know who might be listening. And the twins and their death taught me that the moments on this earth are limited. We could go at any time. So you dang right, I'm going to use the moments I've got to make a difference in this world because somebody has to shout this thing from the mountaintops because it's a rarity.
Yeah, it does seem like we do have to shout because we're so muffled by the big pharma and the amount of medication and money they spend and trying to get people confused. But I see a shift in the water. I've been around for 36 years watching this. I'm wondering if you're seeing a shift.
Yes, for sure they are. And chiropractic is a natural thing. You don't add anything or take anything away to the body. And the way I would adjust an adult, I love Gonstead. I love putting them on their side. I love putting them in a cervical chair. I love being specific and thorough about it, but I can't do that to a baby. I can use the same angles and the same line of drive and the same torque, but I don't dare use the same force. So I have been putting out a lot of adjusting videos online, and there's, mixed reviews about doing that, but you need to normalize it. We need people to see that that's a thing that people do, and that's a thing that keep people healthy.
People do kind of get confused. They think adjusting a baby is like an adult. It's obviously not. The popping and the cracking, that's not even often something I ever had or felt. What would you say to these people that are fearful that, adjusting a baby would be like an adult?
A lot of times I've found with patients, if you try less hard, then they're more apt to get it. So I just use a little bit of words like, well, I've done this for 15 years and fear is not a thing that's real. So let me show you. And usually it's mostly word of mouth these days. And so they've heard from someone else that I'm great. So I don't really worry too much about the fear. If they are hesitant, I will go slower, talk them through it, allow them to help me, maybe hold the baby. There's tools and tricks as you get into it. But most of the time, my patients these days are just from word of mouth. And so the fear isn't there, which is really nice.
All right, Doc. Well, I know we don't have a lot of time here with you. You got to get back to patient care. So let's wrap this up with, where do people find you?
Sure. My website is drkimthor.com. It's for my office, my book, my coaching company, everything. I have a Facebook, an Instagram, and a LinkedIn. I'll be speaking in New Jersey at New Beginnings in October. I usually speak at about 5 conferences a year, so that's pretty fun. So either catch me online, get the book, or see me at a conference.
Awesome, Doc. Well, I appreciate your time. We'll let you get back to your patients here. I'll wrap this thing up on my own, but you be blessed. And, I appreciate you jumping in and helping our listeners understand that chiropractic is for all ages. In fact, the most miraculous thing you're ever going to see is seeing a chiropractic adjustment change a baby's life, because you get it. That change you made changes the rest of their life, and they're nothing but life in front of them. So take your kids, get them checked, get them adjusted. You'll be shocked to see what happens. It's only great. Doc, be blessed. We'll check you. We'll
Sounds good.
catch you
Thanks for
again
having
later.
me. Bye.
We'll let you check out. All right, guys. Well, there you go. These crazy chiropractors out there adjusting infants. I know I'm playing off on that, but it is a fear and a thought that a lot of people have had and say, because they think somehow car accidents are only for old degenerative neck problems and back problems, or maybe a car accident. And so I just have to let you know that the best and the easiest way to keep your spine healthy, it'd be like your teeth. You know, you take care of them your whole lifetime. You get your babies checked, you get your children checked. When they fall, the average child has around 1,500 traumas to their body by the age of 17, typically, and one car accident. There's just no way you go through life without beating yourself up a bit. Car accidents for youth, a big problem. I see so many young people in car accidents, and because they're rubbery and they seem to shake things off, you never get their spines checked. You never get their neck checked. You're stiff and sore for months later, but your kids stay home like somehow they weren't injured. I'm telling you, those children are injured as much as adults are in those car accidents. They need to get taken care of. They need to get checked. They don't often get x-rayed unless they're at an age of maybe 13 or above, but they just need to be checked. So I'm going to get off my pedestal and let you guys move on. But chiropractic is one of the most miraculous things I've ever experienced. I'll illustrate this by my statement I say to all of my staff and most every of my patients. It goes like this: if you could write me a check, and for an unlimited fund, you had a bank account with lots of zeros, and you were going to write me a check, but the only stipulation is when I cashed the check, myself or my family and my children could never be adjusted by a chiropractor the rest of their life. Do you know how much that check would have to be for? Do you know what the numbers would be? If you know me well enough, you know there isn't a number. There's no amount of money you could pay me to never get treated by a chiropractor ever again, to let my family go without care. This is how valuable. I'm a pretty logical guy. I'm decently educated. I'm telling you, this isn't a belief system. It's not a religion. You don't have to believe. Watch a baby get adjusted and you'll see the miracle of what made the body is what will heal the body. All the chiropractor does is unleash that, unkink that. And birth trauma is a real thing. Get your babies checked. All right, this is Dr. Wall checking out. Until the next Unplugged Healthcast, always remember, be healthy, be blessed. Never give up, and never let your kids give up on their health. We'll see you again on the next Unplugged Healthcast.